Welcome, everyone, to People on Dating. I'm your host, Will Morales. And for those of you who are tuning in for the first time, this podcast is about dating, ups and downs, and how to navigate through it. Today, my guest is Anne Truong. Dr. Anne is a board-certified physician with over 20 years of clinical experience, a physician, entrepreneur, and innovator who thinks outside the box. Dr. Anne is a recognized leader in men's health, particularly in regenerative medicine. She is passionate about healing the cause of male sexual dysfunction, not just masking the symptoms. And she shares her wisdom to teach doctors, conferences worldwide. She evaluates and supports each patient from beginning to end to accomplish their individual goals, recapture their vitality, age gracefully, and live their best life. Dr. Ann, thank you so much for being on People on Dating. How are you? That was a
Thank you.
mouthful.
That was kind of a long bio, but yes, but thank you for having me on the show.
No, it's my pleasure. So, Dr. Ann, how did you get here? How was your journey to become a board certified physician? You got 20 years of clinical experience. So what was Dr. Ann's journey?
Well, it's a long journey. That tells you how old I am. So it started in 1997, and I was an ambitious and motivated physician who wanted to help everybody. And I was actually a pain management physician
Okay.
at that time and I was trained in the allopathic, the traditional medical doctor (MD) pathway, which is pain medication and
Mhm.
injection for pain. And then when I got out, I started seeing patients. I realized, wait a minute, I'm giving them medication that's not really helping them for long term. I'm giving them cortisone injection, which is really just band-aiding the problem. They're coming back and they keep having the same problem. So I started looking at other alternative treatment that will really treat the cause of the problem,
Mhm.
and the treatment can last longer. So I started learning how to do acupuncture, prolotherapy, and that's how I came upon your own stem cell, like your blood, the platelets that are in your blood.
Okay.
And so I started injecting those platelets into the joints, into your knee, your back, your spine, and Lord and behold, the patient got better within 2 or 3 weeks, and it lasted for like at least a couple of years. They didn't need any medication, and then when they come back, they weren't that bad. So I was like, I found the holy grail. And one of my patients, it was a man that had ED, and he said, "Well, you treated so well my knee. Can you also treat my ED as well?" He was a 55-year-old male, and 55-year-old, the new 45, right? He
Yeah.
recently divorced. He dated, and he finds that he's not, well equipped, like, not performing well as he used to when he was younger. And he said, "Well, can you put the platelet rich plasma, or PRP, which are your own stem cell in your blood? You did that in my knee. It worked really well. Can you put that, down below? And that way it'll help me with my ED." And I was thinking, you know what? It's actually a very forgiving area. As and it brings in blood flow, and ED, the problem is really decreased blood flow.
Mhm.
So we did that, and it was the best thing because I injected his blood into um, into his male genitalia, and within 3 weeks, he was able to get more blood flow, was able to perform, and he didn't need a medication ED medication to help him out with that. And that was in 2014. No, 2014, right? 2014, and I've not looked back since. And since then, we treated over 7,000 men with ED that has success, and we've also treated women as well. So this is not just for men; it's also for
Okay.
women that doesn't that want to have more sensation down there, that want to have a
Yeah.
better intimate experience. It also help for them as well too. But on that note, your own stem cell can be also for hair regrowth, and for inject into your face for the wrinkles, make you look younger. You can also get that treated for make the breast look a little bit bigger, as well as treating sexual health. So there's multiple areas that you can inject your own stem cell for to make you look younger, act younger, and feel younger.
Wow. I mean, that is quite a journey. So, and it's funny because today's topic is about how Viagra can hijack our erection. So we'll definitely get into that in a second. And I always thought about Viagra. I remember when I was younger and I had heard about it, and thank God I didn't need it, but I knew a couple of my friends that did try it, and they took the 50 milligram, but it gave them a headache. So when I heard that, I said, okay, this is something that I don't want to try. So getting into why Viagra is bad for us, if you could explain, because I guess if we are suffering from ED, or if we just want maybe a longer erection, how Viagra can hijack that.
Right. Well, okay. So follow me along here because I have to explain
Yes.
to you how a man get a natural erection. All
Okay.
right, and then we can get back to why
Sure.
Viagra hijacked it. So the brain is a larger sexual organ. The
Mhm.
brain, not your genitalia, not a male sexual organ. All right.
Right.
So it how you get an erection, it starts in the brain because the brain gets five senses from your eyes, from your the smell, your nose, what you taste, what you hear, and your touch. So the five senses sends messages into your brain to and the brain gets aroused. That's how you get a desire. That's how you get quote unquote in the mood, and that starts sending, and that interact with your emotion that you feel at that time. So,
Right.
so if you're feeling anxious, you're feeling depressed, or if you're feeling anxiety, that's gonna mix along with that. And then there are hormones that gets secreted in the brain
Mhm.
that transmit messages to the nerve, which is the nerve in the back of your neck, which then send the messages to the blood vessels for the blood vessel to start opening up, so that way you can get more blood flow into the blood that goes down to the male, organ.
Right.
Okay. So there's six systems. The system is the brain, followed by emotion, followed by nerve. All right. And hormone, sorry, hormone, followed by nerve, followed by blood vessels, and then the muscles of the male organ. Okay. So
Right.
six systems. And they all have to synchronize and they all have to work in balance. All right. So that's how you generate a spontaneous natural erection. That's why when you're like 25, you can look at a beautiful woman walking by, or you have a dream and you're ready to go. I mean, it works that fast, right?
Right.
So, and I want to illustrate the brain is the largest sexual organ because a man that is paralyzed from the neck down, paralyzed from the neck down, can actually still have an erection and can
Um,
actually father children. All
oh
right.
wow.
So
Okay.
yeah, yeah. So that's why the brain is the largest sexual organ also. So it all starts in here. It starts off the input, the sensories that go to your brain. So I mentioned the six systems. All right.
Right.
So how Viagra work is that Viagra was originally sildenafil, which is generic, or created for a condition in the lung. It was created for a condition in the lung called pulmonary hypertension, which
Mhm.
it decreases the blood vessel in the lung. But what they found out was that one of the side effects of that medicine was that it acts on the blood vessel in it acts on the blood vessel in your penis to relax, to open up the blood vessels in the penis to get more blood flow. All
Mhm.
right. So they found out, oh my God, the guys that was having, pulmonary hypertension, was starting to have these side effects, which they love. They won't give up their medication. So that's
Mm.
how Viagra works. But Viagra just doesn't work only on the penis. It also you can have headache because it opens up blood vessels in your brain. That's why you have a headache. That's why
Mhm.
men have flushing because it opens up blood vessels in your face as well. And then some will have like, blue light flashes that, you have
Mm.
side effects in the eyes. And also there's one thing that you don't see is raises your blood pressure. So for men that have high blood pressure, their blood pressure can raise even to a dangerous level as well too. So it can raise blood vessels as well. Um, so Viagra bypass the brain, bypass the emotion, bypass the hormone, bypass the nerve, and it goes straight to the penis muscle. All right. And
Right.
that's how it relaxes that. So that's why I said that when you take Viagra, you're not involving your brain, you're not involving your emotion, you're not involving your nerve, you're not involving your hormone, you're not involving your blood vessels. You just like straight go down to the penis. So you're skipping step 1 to 5. So that's why it
Oh,
hijacked your natural response to erection. So what's happened is that the next time you have a sexual experience and you don't take Viagra, your body's gonna go, "Oh, I don't know what to do." Because I haven't used my brain. I haven't used step 1 to 5. I haven't used my brain.
mm,
I haven't been aroused yet. I have not. The hormone hasn't been released. The nerve hasn't been stimulated. I don't know what to do. So then you find out, hey, you didn't use Viagra, you can't get an erection again
wow.
because you're thinking, oh, I need Viagra for my erection. But then maybe the truth is that your body it used to taking Viagra for your erection, and it's forgotten how to generate its own erection. So
I
that's
see.
why it hijacked your response to an erection. It's like taking a shortcut. But and then some people go, well, who cares? Who cares? I'm performing, and it works. Well, after about 2 to 5 years for those that doesn't have the side effects, because the number one side effect is headache and flushing, and men don't like that at all. Okay,
Right.
but sometimes they tolerate. But then after 2 to 5 years, you don't respond to Viagra anymore. It stops working. It really does stop working.
So we talking
Right?
about short term.
Yes, it's just a
No,
Band-Aid. It's
yeah.
a Band-Aid and stop working because remember, it opens up the blood vessels in the penis. But you have to understand that ED is really a decrease in blood flow that is beyond the penis. It's kind of like in your blood vessel that are in your abdomen. That's
Okay.
what's causing the decreased blood flow that is causing you to have ED. So the bottom line is that it's not addressing the root cause of why you have decreased blood flow, which is why you have ED in the first place. It just kind of go to the muscle and give you some short term benefit, but in the long run, the root cause of why you have ED gets worse. Because sometimes it could be the 5 common reason why men have ED is high blood pressure, diabetes, high cholesterol, smoking,
Mhm.
not getting enough sleep. You need to get 7 hours of sleep, stress, and overweight and inactivity. Overweight meaning if your waist is like 40 inches or more,
Right.
or if your BMI is over 30 BMI, and inactivity. You're not exercising, on a regular basis. So those are the 8 common things that are reversible. All right. And also, I didn't put on there is alcohol, too much alcohol. I'm talking about like, more than, 3 drinks a day
Right.
on a daily basis. Because alcohol is also toxic as well. So you should really be addressing those 9 factors that I talk about instead of taking Viagra. Because when you take Viagra, you're going to end up in the black hole in a few years. Because one, you hijacking your body response. Your body doesn't know how to get an erection anymore. It
Right.
doesn't know
Because
how to stimulate step 1 to 5 anymore.
right, because we're relying on Viagra to do the work for us, but we're not letting our brains, like you said, our senses get involved in the process of being attracted to a woman physically, emotionally, and all that. We're relying on a pill but I thought, and tell me if I'm wrong, by talking to some of my friends back, I'm talking about years ago, um, it was because they wanted to last longer in bed. They wanted to make sure that they perform well. So even though they didn't have any blood flow issues, but they thought that the pill might make the erection harder and also last longer in the sack, so to speak.
Right, right.
What do you?
There, so
Yeah.
that is, yes, that does help with that because it decreases the blood vessel. It opens up the blood vessel in the penis, so it does. If you don't have any ED issues, it does make it firmer. However, your penis muscle will get used to that, and it will stop working after a
Mm,
while. Okay, It will stop working after a while, and that it lasts longer because what happened when you ejaculate, the blood vessel is still active, so you still have some residual blood in there. So that's why
Oh,
you can last longer. But again, your body is made so that way you can have an erection without Viagra. Your body does not need Viagra to have an erection. And if you keep on doing that, your body's going to lose the ability to have its own erection. So yes, if you don't have ED, it may enhance your performance, but that's just short term.
right,
That's just short term, and in the long term, in the long run, it's not going to work anymore.
right.
It isn't going to work anymore.
Yeah, right. Because it's like you said, though, if we take care of ourselves physically, exercise, watch what we eat, keep our waist under 40, which it's funny. I don't even think I ever heard that once it
Yeah,
gets above 40, now you're, in danger.
40 inches. Yep.
Yeah.
Yep.
And but and the alcohol, yeah, I definitely heard about that. Too much alcohol. So once we eliminate, we get on a diet, we exercise 3, 4 times a week, we eat a little bit better, we sleep more. So we'll start seeing our brain work more in tune with our genitalia.
Yes, yes,
Okay.
absolutely. Because blood flow is a reflection of your lifestyle and what you eat. Because we have I think we have I have like miles and miles of blood vessels in our body,
Right.
and it's lined by a tissue called the endothelium. And the endothelium, imagine it as a very sensitive lining of a pipe, and it's very sensitive. So whatever you eat will affect the lining and the barrier of that endothelium. So it depends on what you eat, depending on the inflammation level in your body. So
Right.
simple things such as a diet. What kind of diet should you be eating? You should be eating a Mediterranean diet. Diet with lean meat, more fruits and vegetables, and less red meat. I
Mm.
tell my patients you should be eating red meat about maybe max twice a month, not twice a week, twice a month, and more fish, more chicken. Your plate, 3/4 of it should be filled with vegetables, um, and more fruit. Less refined sugar. And the Mediterranean diet allows you to eat to drink like one glass of red wine a day, and then multigrain bread. So that's the diet, and the exercise is, going to the gym or do high intensity interval exercising, and all you need is really 3 hours a week, really.
Which
And
doesn't
if you
seem like a lot, right?
no, it doesn't seem like a lot, but you find out that you're gonna sit and watch Netflix more than 3 hours a week, right?
Can,
People go,
can,
"Well, I don't have time." I go, "Well, how many hours you watching Netflix a week?" You you can definitely replace the network of Netflix time with, even on the treadmill. Let's say you don't have time. Well, you can watch your show while you're walking on the treadmill. Some exercise is better than nothing because it gets your
yeah,
heart pumping, right? And sleep. Sleep 7 hours at nighttime, right? Your body heals physically and mentally between the time 10 p.m. to 6 a.m. Your body heals. So if you
right.
don't sleep, your body doesn't get a chance to heal physically and mentally, right? You ever notice that when you don't have enough sleep, you're grumpy the next day. You're just
Yeah.
not at your peak performance, right? And another thing too is so you exercise, the diet, and the sleep and smoking. Smoking is the number one killer of your sex life. Not only just your sex life, but everything else. Because smoking is inflammatory and it
Yeah.
damages the endothelium, like I talk about, that the lining of the blood vessels. As well as alcohol. Alcohol, more, I recommend that men stay between 7 to 10 drinks a week, which is
Okay.
quite generous actually. You can have like
That's still
one
a
one
lot, but
drink
yeah,
a
I get it.
day. Yeah, that's still a lot.
But one glass. I'm sorry, Dr. Ann. We're talking with
Yeah.
Dr. Ann Truong, board certified physician. So Dr. Ann, it, drinking one glass of wine a day, is that okay? Doing
Yes.
that? That's
Yes,
okay.
yes.
Okay.
Yeah, that's okay. Drinking one glass of wine a day or even one beer a day is okay. Or 2 ounces of hard liquor.
Okay.
All right. So that's considered one serving as well. and between 7 to 10, and you don't have to drink if you don't want to,
Right. I,
and so that's kind of like the sweet spot right there. Yeah. And but the main thing is quitting smoking and sleep, and then the diet and the exercise, because if you control that, then if you do that well, you don't need to worry about high blood pressure, right? If you exercise,
yeah.
you eat well, you don't gain weight, so you don't have to worry about high blood pressure. You don't have to worry about diabetes. When you're eating well, you don't have to worry about high blood sugar, which is diabetes. And if you're eating well, you're exercising well, you wouldn't be worried about high cholesterol, right?
Right. And that's where
So
the veggies and the fruits come in by at
yeah,
least having some snacks that are more healthy. Definitely, I agree with you with the smoking. I don't smoke cigarettes. And it's funny with the side effect of Viagra. So this is definitely a wake up call because, again, if we have what you just mentioned, just exercising, eating right, sleeping, quit smoking, not drinking 3 or 4 glasses a day of alcohol, hey, we'll get that blood flow back to our genitalia. So that's amazing, Dr. Anka. This is something that I'm pretty sure 99% of us didn't even know.
yeah, no, it's actually, that's why it's quite simple. So for your audience, in the dating, let's say right before you go on a date, so make that day, eat well, no, don't drink before you go on the date, and maybe to have 1 glass of wine, not drink too much, and maybe exercise that day, sleep
Right,
well the night before,
right.
and watch what you're eating, because when you eat a high fatty diet, that's going to reflect it's inflammation there. You eat a high
Mm,
fatty diet. In fact, most men don't know that you're taking Viagra and you eat a high fat diet, the absorption of Viagra is lessened. So Viagra
okay,
is dependent upon what food you eat that day, as well too, and that about 30% of people just don't respond to Viagra at all.
okay,
Yeah, because the source of their ED is 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 different than what Viagra does. And so to do a natural enhancement before you without Viagra, let's go on a date, then eat a beets. All right, you want to eat food that are full of antioxidant that has L-citrulline and
beets.
L-arginine. Yes,
Okay,
beets. Oh my God, beets and watermelon has a lot of L-citrulline in it. Okay, uh, collard green, spinach, kale. In fact, your listeners, I'm going to give them a treat today. This is something that I usually actually charge patients for, but I'm going to give them a treat today of my morning wood smoothie that you
okay,
can make. It will take you 10 minutes to make with this loaded ingredient of this loaded ingredients. I'm gonna pull it up real quick here, and but one of those ingredients I just mentioned it, and that is beet, and that's 1 cup of beet. Okay, 1 cup of beet a day, and not a day, 1 cup of beet in your. I'm gonna pull this up. Be patient
okay.
with me.
No, that's fine.
Yeah.
I mean,
Uh
this is
huh.
amazing, amazing information. So, for the guys, just think of it. Uh, Dr. Ann came up with 6 systems of the body that could that we have that affect our senses if we're not, dieting right, if we're not sleeping right, if we're drinking too much alcohol. Uh, Kill the smoking, stop smoking. We can't rely on Viagra because we have our senses to rely on. If we dull our senses because we're taking Viagra, and like Dr. Ann says, after a few times using it, the body's going to say, hey, wait a minute, where's the Viagra? I can't work anymore if I don't have the Viagra. So she says, have maybe 1 glass of wine. Uh, Cut the red meat to maybe 2 times a month, not 2 times a week, but 2 times a month. She also recommends maybe getting on a Mediterranean diet. Beets. Now she started talking about beets. So this is something that,
Right. So this
I mean,
so this is the formula. Okay.
yeah.
So you want to have 1 cup of either kale or spinach or collard green. All right.
Okay.
And then 1 cup of fresh beet. And you can actually buy the beets like frozen too.
Oh,
You don't have
okay.
to have it fresh. All right. And you have 1 cup of blueberry. because
Oh, I love
blueberry,
blueberries. Yeah.
yeah, blueberry is the way to go. Okay, and okay, so I'm missing. It's like 5 ingredients in here.
Right. So we said
Okay,
beets, kale, and blueberries.
yes, right. Okay, yep. Blue. All right, and you add in a cup of almond milk,
I like almond milk. Okay.
a cup of coconut water. All
Coconut
right, yeah.
water.
All
Okay.
right, and then you want to add cinnamon, just cinnamon powder in there. Okay.
Cinnamon, cinnamon powder.
Yep,
Okay.
just like a teaspoon of cinnamon powder. And then you add 4 to 6 walnut. Just walnuts. Add in the blender.
Okay.
Okay.
And then
You
blender.
blend it all in together. And
Oh,
then,
okay.
yeah, blend it all in, and you can add ice if you want, or you can add water
Okay.
to to change the consistency to either a little bit thicker or a little bit watery. And that's your morning smoothie every day. I mean, you have all the ingredients, put it in the blender, drink it every day, and that's an antioxidant. That's good for your bedroom performance, also good for your heart. You
Okay.
do this, in the morning and at night. That that's all you need to do, and you can switch it up with, you can add in yeah, either macadamia nuts or walnuts. But those are the fruit that are good, that has high content of L-citrulline and L-arginine.
Yeah.
And you can add watermelon to it as well, too.
Okay.
Okay.
So we're
Yeah.
talking about 1 cup of beets, 1 cup of kale, 1 cup of blueberries, 1 cup of almond milk,
Yeah.
1 cup of coconut water. Add some cinnamon powder, 4 to 6 walnuts.
Yep.
Right. And then we blend it. You put it in a blender, and we can add either ice or water to have maybe the thickness. I love what you said before, the morning wood shake.
Yeah.
I think I'm going to write that on the show notes. Well, anyway, first of all, Dr. Ann, I appreciate you so much taking time out of your busy schedule to talk to people on dating. And before I let you go, there's a couple of more things. So I know on your website, I looked at it, you have tons of tabs, tons of like health, I guess you could say healthy issues for men. So I want to talk about the male sexual health tab
Uh-huh.
on your website. If you could just maybe talk a little bit about that.
Sure. Sure. So my website is truongrehab.com. It's spelled Truong rehab, rehab.com. So in the tab, I put down all the treatment that we do for a man to live his best, happy, healthy life. I call it happy, healthy, prosperous life, because if you're happy in the bedroom, you're happy in your life, and you're happy in your life, you're productive, you're making all the money you need to make, right? So it's
Right.
happy, healthy, and prosperous. Because at the end of the day, we're not talking about dirty stuff. We're not talking about taboo. We're
Right.
talking about happiness, right?
Yes.
We're talking about self-confidence. We're talking about relationship, because that's what we all want as human. We want to connect with people. We want to be happy, and we want to feel that we're contributing. And so, for especially for a man, because a man is a caretaker, right? He takes care
Yeah.
of his family, he takes care of his household. And so in our sexual health tab, we do the P shot, which is what I said, using the platelet rich plasma
Yeah.
to treat the more increasing blood flow in your penis, to treat with ED. And shockwave therapy, it's using sound wave energy to deliver that energy to the penis for increasing blood flow.
Okay.
And then I also do testosterone pellet, which is giving men extra testosterone as you age. Men after the age of 35, you lose 1% of your testosterone, and your
Right.
testosterone is what help with your erection, as well as help with your maintaining your weight. And testosterone help you with decreasing body fat, as well well as energy and focus. But unfortunately, at the age of 35, you lose that quicker. So that's why I was saying some men don't respond to Viagra because their testosterone level is low.
Okay.
You
Okay.
know, so we supplement testosterone by giving you like a little pellet, which is I put that underneath the skin, underneath the buttocks, so that way you get natural bioidentical testosterone release every day.
Okay.
And then peptide therapy. Peptide therapy is just like small amino acid chain that you get injected to help with erection by increasing the sensitivity of the nerve. Um, we also treat men that had prostate surgery from prostate cancer
Right.
for them to restore back to sexual performance. And we also treat for Peyronie's disease, or a man with a curvature in the penis, as well as enlargement. 87% of men feel that they're not endowed enough. And even though I would tell you that there's a large study that looked at 15,000 men at all nationality, ethnicity, and the average length for an erect penis is about 5.5 inches,
Right.
average length. So that's average. So and if you're round right there, you should be good. And so those are the main things that we do for men sexual health. So I look at it as restoration from inside and within. So you have to start with diet, exercise, sleep, like all the stuff that I mentioned before. You
Yeah.
have to look at your lifestyle. Are you smoking? Are you drinking a lot of alcohol? Are you sleeping? Are you managing stress? So all of that will affect your health. So you have to heal from the inside out, and it doesn't take any magical formula. It's just what I said before. Eat well, sleep well. Exercise even just means walking an hour 3 times a week. The better than nothing. Better than sitting on your butt watching Netflix for every day. Now, I mean, I watch Netflix too, but I don't let that interfere with my physical activity. I'll be on the treadmill while I'm watching, Sex in the
Netflix.
City. I'm
Right.
doing something to multitask at the same time. And so my approach is always comprehensive, healing from the inside out, and focusing on lifestyle factors. And I truly believe that if men that are healthy now, if they start to feel that, hey, I'm not the same like the way I was when I was in my 20s, then start instituting the 9 changes that I talk about.
Yeah.
If you start instituting that, I have seen my patient go, and if you actually eat better and exercise, your testosterone level will increase also as well.
Right.
So I've seen some of my patients that if they start doing this, I see they improve in their not only their testosterone hormone but also their sexual performance as well. That's even before any treatment. But if you don't know this, you keep doing the bad things over and over again over a year,
Yeah.
then it's going to be hard to reverse, and that's when men need more aggressive treatment from myself to restore blood flow. And I want to get the message out there that men stop Viagra. All right, but I
Yeah.
see Viagra as like taking pain medicine for your back pain, taking your
Gotcha.
Percocet, your OxyContin, because you know what? It gives you short term relief, but in the long term, in the long run, you're not benefiting at all, and you're actually harming yourself more, and you're creating a habit. It becomes a crutch. It's so hard for some of my patients to stop thinking that they need Viagra in order for them to perform, even though they are performing, but their mind thinks that I need that, I need that.
Yeah.
And so a part of it is also a psychological dependency on it, because you think that you need it to perform, right? When in
Yeah.
reality, you don't need it at all. And in reality, it probably harm you more. So I put Viagra on the level of like almost like pain medication addiction.
Right.
Because it's short term, but in the long term, guys, you're gonna end up hurting, and then your body doesn't know how to respond. So that's why men that take Viagra try to get off of it and find out, oh, I'm not performing. Oh, something's wrong. I'm gonna get back to Viagra. It's because you haven't given your body a chance.
Right.
to recover and to, get into the rhythm of things again. And I want to say also that, that's the thing is you don't use it, you lose it. So
Right. I heard
yeah,
too.
yeah,
Yes.
but
Yeah.
yeah,
Yeah.
the muscle gets, the penis muscle gets smaller. And
Hmm.
if you don't use it, you lose it. That's one of the reasons why men have, nighttime or morning erection, right? That's when your penis gets exercises, and that's when it gets more blood flow in it. That's when the muscle gets relaxed, and that's when it exercises. An average man get 3 to 6 erection a night, lasting
Right.
about 10 minutes to 30 minutes. So
Okay.
you exercise. Let's say you get 6 erection. You exercise time 30 minutes. That's like 180 minutes there. So you're exercising there. But if you notice you're not getting it as much, then you need to kind of evaluate. Okay, what am I doing? How's my diet? Am I exercising? How am I doing with that? And don't go for that pill. And I'm hoping to educate men that that the pill is not the solution at this
Yeah.
point.
No, no, we'll definitely get it out there. And anything you would like to promote? Anything before I let
Yeah.
you go?
So my passion is education, because I feel that what to do, you can avoid, right?
Right.
And I believe that sexual health should be considered like your teeth. Like you go to the dentist, get your teeth cleaned twice a year to prevent decay when you get
Right.
older, right? And I feel that sexual health, you can do the same thing. Prevention. Well, how do you prevent? Is knowledge and education. So I have a coaching and education program called the Modern Man Club that educate men with ED, or start when they feel they're not at 100%, is what to do when they have ED, and how to start reversing it, and how to stop the toxic behavior, and know when to go to the right place to get treatment. There's a lot of people out there on the internet trying to sell you stuff, trying to make money. And the last thing I want them to do is to get misinformed and buy harmful things on the internet, because these people are good at sales. So I'm passionate about education and getting the right information. So your audience can go to my this website called mensexualityclub.com, is where they can get more information about my Modern Man Club, because the modern man to me is a man of the 21st century that wants to live a happy, healthy, prosperous life without medication, and it can be done. And I truly believe that all of us can have sexual vitality until the day we die. And that is definitely possible, because I've seen some of my men in their 80s enjoying intimacy even at that age. And so they can check it out at mensexualityclub.com is my membership, and my website is truongrehab.com. And they can also find the men's sexuality club under the Modern Man Club, under the tab for patient. Um, so I'm big on education, because I'm
Yeah.
big on knowing. There's such a thing as you don't know what you don't know, right? You don't know, you
You
don't
don't
know.
know? Exactly.
You don't know what you don't know. But if your listener even just listen to 1% of what I say today, they're gonna go,
You
oh,
helped. You helped. Yeah,
yeah,
exactly.
yeah. And I'm that's what I'm there for, is to be a change maker, and to also educate for something so important, something so deeply important and integral in all our life, but yet we don't know that much about, right? Like you
Yeah. No,
said.
very true.
Yeah, it's just, no, we don't know that much about. I mean, it's something we enjoy. Something, if they weren't for sex, we wouldn't be here, right? You and I wouldn't be here sitting talk to each other, right?
Exactly, exactly.
Right. And so I that's why my point is to bring it out of the closet, out of taboo, and yeah, and say that, hey, you can do something about it. You don't need a medication. Let's start a conversation about this, and you don't have to hide. You don't have to go and hide in the Dr. Google, to do that. There's a reason why we are, as doctors, we have 16 years of training, and not from Dr. Google. And
Right.
I'm just amazed at some of the people that are out there on the internet or on YouTube that are, not physician, teaching,
Yeah.
topic that perhaps, should be more research and investigated. So education is my passion. And I hope that, your audience can get something out of this episode.
No, no, believe me, we will. We will. Well, anyway, Dr. Ann, I appreciate you so much for taking time out of your busy schedule to talk to people on dating. I really, really appreciate it.
Well, thank you for having me here. It's my pleasure.
Well, everyone, that was Dr. Ann Truong, and you can find her at truongrehab.com. That's TRUONG rehab.com. And, or Dr. Ann, thank you so much for being on People on Dating. Much appreciated. You can find me at peopleondating.com. That's peopleondating.com. Check out our past shows and check out our blog. Also, when you get a chance, please go to YouTube, People on Dating. Please subscribe. Leave a review, share it, like it, whatever you can. Please, please, please. Also, you can find me on Google Podcasts, Apple Podcasts, and Spotify. Anyway, guys, on behalf of People on Dating, I'm Will Morales. Until next time, thanks, everybody. Have a great day. And remember, it's just a conversation, no judgment. Bye.